right, it's time to start thinking about healthcare coverage for 2026. Many employers have open enrollment periods right now, and open enrollment runs through healthcare.gov and it begins November 1st. So with costs constantly going up, we want to help you today so that you can plan for tomorrow.
This is one that affects everybody. Lisa Gill is here in the studio this morning, an investigative Consumer Reports reporter and focusing on healthcare concerns. This is something everybody's going through right now, open enrollment. Right. I always get a little anxious.
I'm anxious. I haven't even finished it.
You know what? I don't want to push the wrong button or do something that might affect the healthcare. All right, give us some basics. What are some factors we should consider this time of the year when we're picking out our health care plan for next year?
First thing is, if you're losing insurance from your parents, you've been on your parents' plan this whole time and now all of a sudden you are in the free market, you got to act now. Don't wait until you're sick. Don't wait until something catastrophic happens. Sign up today or starting now during open enrollment, either through your employer or through ACA.gov and pick one of the individual plans there. So acting fast.
Do it quick. Okay, I've already done mine. Have you done yours yet?
No, I'm nervous. I'm still looking at all of the options. But
and there are so many options.
This is the reason why. There's so many abbreviations, Lisa. I mean, it can be confusing. There's PPO, there's HMO. What are the differences and the benefits to each one?
That's right. Your two big buckets are these acronyms. They're terrible. HMO and PPO. Health Maintenance Organization or Preferred Provider Organization. But the main thing is HMOs have a closed network, and so they're actually a lot more affordable for somebody who's signing up for a plan. PPO is a much more open network. It means you can see all kinds of doctors, and your plan will cover all those visits. So I would say if you're managing an ongoing illness like type 1 diabetes, which requires you to constantly, really be in touch, high touch with your doctor, you're probably going to want a PPO to make sure that those physicians are always covered. But HMO is a super affordable plan also.
That's a great point. I hadn't thought about it like that. If you're dealing with something like diabetes, you want to be in that regimented plan so that you can continue that. All right, let's talk about the pros and cons of a health savings account. Another one of those abbreviations, HSA. We have one through our plan.
Oh, good. Okay,
I find it very enjoyable.
He was trying to get me. He said, Yvonne, you have to look into it. It's very beneficial. So tell us more about that.
So whether you're signing up for at ACA.gov or through your employer plan, ask about HSAs. This right, another acronym, Health Savings Account. And what it allows you to do is to take money from your paycheck before it's taxed.
That's the key.
And you put it into an account. That account can sit there and grow and grow. You'll get a card, usually like a type of credit card that you can use for all kinds of things like deductibles, or even when you go to the pharmacy and have to pick up prescriptions, or even buy sort of like maybe contact solution or sort of other medical related things. And what's so great about an HSA is that you can have this account from employer to employer to employer, or if you have an ACA account that you just keep with yourself, you can keep it the whole time.
It rolls over too.
It rolls over.
If you don't spend it all, you can carry it over into next year.
Yes, that's
Wait, but hold on. Do they match some of that money, or
they can?
They can.
So an employer can also sometimes. So maybe you should ask your employers.
Yeah, ours does.
They do.
Match money, or sometimes just put a deposit in there so that there are some funds to like. We didn't talk about deductible, but here's like yet another term. Deductibles are like often what the insurance company requires you to pay up front, out of pocket, before the insurance kicks in. So those deductibles can be $500, $1,000, $2,000, sometimes a lot higher than that. And so having that health savings account money sitting there to help pay for that is a great move.
It's a great move.
Along the same note here, what are the key differences between HSA and then an FSA, which is flexible spending account? Because do we have that option as well? Some places have.
Yeah, so some employers offer the FSA, another acronym, and not all employers offer both.
Okay.
Those are a little smaller. They have like a limit that's smaller. They don't necessarily move from employer to employer, but they're essentially, in my book, they're about the same thing. And so just find out which your company offers and if you can sign up for either.
From what you've seen so far with this government shutdown, who knows how long this is going to take with the Affordable Care Act and signing up through that. How is that going to be affected? Is it going to be affected?
It is. So the government shutdown is one huge problem, but actually what's happening at the end of the year is that something called subsidies, which are basically credits or like discounts for people who sign up at ACA.gov for an individual plan, those are going to expire unless Congress renews them before, like literally the clock is ticking. So if they don't renew them, it means that some of these plans are going to become very expensive because you're going to be on the hook for like the full monthly premium where you may have been getting a discount before. And not only that, plans actually are expected to go up in price, almost 20%, in some cases higher, going into next year because they're gearing up for this problem. And so some consumers might be hit with a double whammy.
Is there anything else at risk because of the situation that we're in right now?
Well, probably all kinds of things. It's like another segment.
Do you have
Like all kinds of
30
things.
minutes?
I mean, this issue is so serious because it could mean that your premium goes from maybe $250 a month to like $500 or higher. So it could essentially double these premiums. And you know, for some families, that's going to be a major issue.
Okay.
So let's
That's
hope,
just
let's hope that those
risk.
credits get renewed so that individual consumers don't feel that pain, that pocketbook pain.
Another thing that I noticed is, I mean, as you're getting older, I keep thinking, oh, I'm going to use this same plan. But as you're getting older, there's
my
more
gosh.
of it. You know, like I had like a little health scare a couple of months ago, and I was like, oh, why I don't have this kind of coverage because I didn't plan for it. But as you're getting older, you should plan for the fact that you're not as spry as you used to be 10 years ago.
I mean, not for nothing, these plans change every year.
do.
So even the plan that you think, oh, it's the same one, my employer is offering me the same plan. No, these benefits, it's all the fine print changes. So the amount of the deductible that you have to pay out of pocket,
Oh, that
that can
deductible.
change. Or you know, maybe some of the coverage, maybe your doctor no longer takes that plan, so you might be forced to like find the plan that your doctor does take. I mean, so you need to check everybody. You know, and that includes anyone that's on Medicare, an ACA plan, or an employer plan. You got to check every year before you sign up.
And sometimes paying a little bit more upfront will save you in the end because sometimes it seems like it's like, where's that deductible again? Like, it takes me forever to get to it.
That's true. You know, and that deductible can change too. It's like, and you know, there's different deductibles sometimes. So you might have one deductible for all of your physician visits. You might have a second deductible for your prescription drugs. So just double check to make sure that like you don't get surprised by these things when you're standing at the pharmacy counter ready to pay and you're like, wow, I didn't know I had a $500 deductible that was separate from my physician's deductible.
That one got me.
That's like it's like the worst surprise.
Yeah,
it's the
So
worst.
it's not
surprise.
from, doesn't all come from the same pot.
No, not necessarily. You know,
Yeah.
and some employers have, you know, you may have we don't have a deductible necessarily, but some plans do, and it's amazing. You know, employers, in an effort to try to really help employees pick a good plan, may offer a lot of plans. So you need to check, like, hey, what are the total deductibles on all of these before you sign up?
I'm a little less anxious thanks to Lisa.
We didn't even talk about dental.
Oh, that's a whole nother. Oh my gosh.
My chiclets. We do we do have a little bit of time. But anything with dental, we need to know. Jeez.
You know, I would say one thing is like really important. So, you know, when you go, you kind of mentioned this earlier, like, you know, when you go, especially to ACA.gov, and you're going to type in all your information, a couple of things. Make sure that you bring your tax returns with you because you need to, it's income based. So you're going to need to put exactly all their tax information as you reported it already to the IRS. That's really important. And the next thing is you're going to be hit, especially I was kind of looking for Austin, you know, there are like over 100 plans, and actually it's like higher than that. So you're going to be wanting to sort by the really good plans. They're rated bronze, silver, gold, platinum. You're going to want to be looking for those like minimum silver and gold, platinum if you can afford it. But what you're really looking for is that deductible. That's going to be your main thing, and also to make sure that your doctors and your physicians, the hospital that you're located near, is covered in that network, and that if you need to go outside of that network, you're not going to be charged like, you know, crazy prices, that you want some coverage.
So we want to make sure that they're covered. Do we individually call these doctors, or we just check?
I like doing that. So if you have a doctor that you're like, I need to see either this practice group or this physician specific, I would be like a little OCD about it. I'd be like, every plan that you take, and let me see if I can match it up with one that I get.
Okay.
Well, last question. Is it always the fact that the higher the deductible, the less out of pocket per month you're going to pay, or is that just
in theory, yes. So that's also another really good question, because you always think like these two things are correlated. And I would say generally speaking, yes, but just be sure that lowered, you know, that sort of like that higher deductible is associated with a good plan, if possible. So your employer may not show you that gold, silver, bronze rating necessarily, but the ACA.gov website does.
Okay.
And you just got to pay very good attention. You really want to avoid all, I would say, bronze plans. It just means that more people complain and that you might spend more money and actually get less for your dollar. And that's
Great information.
I'm gonna
Great
get Lisa's
information.
cell number. I'm gonna be texting her
talk
at
to
all
you.
hours of the
I will
night.
answer any questions. We help people all the time sign up and save money on prescription medication. So
Thank
you
you.
can reach out anytime. Lisa,
Where can we find you?
Actually, consumerreports.org. We have
There you
a
go.
ton of free
Yeah.
information.
Okay.
Great.
We've written a lot of stories about how to manage medical debt, high medical bills, what to do if something's not covered and you're on the hook for huge, $10,000 bills and higher, which is just, this is why you need, this is actually why you need
I love
insurance
it.
to
I love
avoid
it.
that.
But you're my kind of girl because she explained it in layman's terms.
That's the way
when
I
you
like
start
it.
speaking in fluffy speak,
right.
you lost me.
I love
You know what
Consumer
I mean?
Reports. We run Consumer Report stories all the
All right,
time
thank
here.
you. Well,
Thank you,
great.
Lisa, for
Thank
being
you.
here.
Thanks for so much.
Thank you.
Absolutely.